Hi everyone and welcome to our module on the spleen. Now in this module we're talking about everything there is to know about the spleen. We'll start off by introducing it, talking about the functions, shape, size, extent, practically the gross anatomy, and then we'll talk about the histology and embryology of the spleen at the end of the module. The spleen is the largest lymphoid organ in the body. It is an intraperitoneal organ found within the abdomen, and that's the reason why we'll be talking about it under the module of the abdomen. It is located specifically on the left upper quadrant or the left hypochondrium of the abdomen, and it is said to be one of the most vulnerable organs, if not the most vulnerable organ in the entire abdomen. It is not a vital organ, however, so even if there's a damage to the spleen, one can survive without it. So it's not necessary for to sustain life. So what are the functions of the spleen? The spleen has numerous functions. Aside it being part of the immune system, it is involved in the process of hematopoiesis during the development of the fetus. During fetal development, there are separate sites in which blood production or blood cell production tends to occur, and this would include the yolk sac at a certain point or at earlier stage, then the liver and the spleen, and then eventually the bone marrow. So the spleen at some point serve as the site of hematopoiesis. In the adults, the spleen is involved largely in immune defense. It also serves as a blood reservoir, as we would see in terms of the storage of the spleen. There are sites particularly involved for immune defense and a sites particularly involved for blood reservation. It also is involved in the help of self-transfusion in response to hemorrhage. So because of its ability to store blood, whenever there's hemorrhage, whenever someone is having hypovolemia due to loss of blood, the spleen serves as a form of store and eventually transfusion site for the body. So it helps in self-transfusing the body whenever there's loss of blood. The spleen also serves as a site of iron storage, and finally, it is particularly involved in the destruction of old red blood cells, old and defective red blood cells. So blood cells that have red blood cells that have lived a complete span of 120 days will be destroyed by the spleen. In terms of gross anatomy, the spleen is said to be an ovoid shaped purplish mass. You get to see it in the labs. It has a very unique set of dimensions. We usually refer to this as the old spleen. This is in terms of its inches, in thickness, width, length, as well as weight. So in terms of its thickness, about 1 inch thick. That's about 2.5 centimeters. In terms of its width, it's about 7.5 centimeters, about 3 inches wide. It's about 5 inches long or 12.5 centimeters long. And then finally, it weighs about 200 grams or 7 ounces. So we tend to remember each of the inches and ounces of the spleen in terms of odd numbers. So 1 inch thick, 3 inch wide, 5 inches long, 7 ounces in weight, and then just to extend that further, the extent of the spleen tends to run from the ninth rib to the 11th rib. So we complete that odd number, ninth and 11th, in terms of its extent. More on the gross anatomy, the spleen has two major surfaces and four borders. The surfaces of the spleen is named based on the structures related to it. So we have the diaphragmatic surface in which it is in contact with the diaphragm, hence the name. And then we have the visceral surface, which is in contact with a number of viscerals. Each of these visceral spaces tend to have particular impressions that serve as sites where other organs or viscerals are in contact with the spleen. We'll talk about that very soon. The borders of the spleen are four in number. We have an anterior border of the spleen. So the anterior border of the spleen would include the part that is pointing anteriorly, dividing the diaphragmatic surface of the spleen from the visceral surface of the spleen. Then we have the superior border of the spleen. So the superior border is at the top here. Then we have the inferior border of the spleen, and then finally the posterior border of the spleen to complete a total of four borders of the spleen. So you can see superior, inferior, then anterior, and then posterior borders are all shown here. Let's talk briefly about the relations of the spleen. And remember, I said that for the visceral surface, especially, we have a number of structures related to the spleen, and these structures tend to form depressions or impressions on the spleen. So, anteriorly, the structure in front of the spleen is the stomach, and you could clearly see the impression of the stomach just on the anterior surface of the spleen or the visceral surface of the spleen shown here. So, this is the stomach area. All right. So the stomach sits just directly in front of it. Posteriorly, we have the left part of the diaphragm and the ninth to 11th rib. And remember that these are the structures that are found at the in relation to the diaphragmatic surface of the spleen. You can see the ninth to 11th rib running at the back of the spleen, and alongside that, the diaphragm will tend to cover. Inferiorly, we have the left colic flexure, and there is a small impression just directly at the inferior part of the spleen where the colic area tends to be mounted on or tends to be attached to. And then finally, medially, we have the left kidney having its own set of impression called the renal impression at this area. So when we're looking at the spleen in the gross lab or in the anatomy lab, you get to note each of these impressions. We have the impression of for the stomach, or we call the gastric impression. We have the impression for the kidneys called the renal impression, and then we have the impression for the left colic flexure called the colic inflection impression. Rather, and all of these impressions are found particularly on the visceral surface. Whereas on the diaphragmatic surface, we have just the ninth to 11th rib and the diaphragm bounding that posterior. So this is just another image of the spleen and structures related to it. You could see the stomach in front of the spleen. You could see the kidneys just at the medial side of of the spleen. And as well, you could even see the pancreas, although not directly in contact, but the pancreas and the spleen are tend to be connected um, to one another. And that connection also extends to the kidney. So if you remember the renal ligament, that ligament connects the pancreas all the way down towards the kidneys. And then at the back of the spleen, you can see muscles alongside ribs present. You can see the 9 to 11 rib, not necessarily shown here, but just a part of it that bounds the spleen posteriorly alongside the diaphragm. What's the blood supply to the spleen? Spleen is supplied particularly by special arteries to it. So we have the splenic artery supplying the spleen directly. This is a branch of the celiac trunk. And then the splenic veins that drains the spleen. The splenic veins tend to join the superior mesenteric vein to form the portal vein. So all the venous blood of the spleen will be drained into the portal vein eventually. And then finally, the nerve supply to the spleen comes from the celiac plexus. The celiac plexus, as you remember, is subdivided into sympathetic and parasympathetic path, and each of these paths are involved in supplying the spleen. This image shows for us the blood supply to the spleen. You can see the celiac trunk, and from the celiac trunk, we see three major vessels emerging from it. We see the the splenic artery, which is of importance, the common hepatic artery, also of importance, and to see the left gastric artery also being the third artery. But the splenic artery is one of importance. So you can see how large this artery is. One important thing to remember about the splenic artery is the fact that it is tortuous in shape. It's not really shown in this image, but if you have to see another image of the splenic artery to have this serpentine appearance, which is going to be tortuous as it's running towards the hilum of the spleen. So hilum of the spleen is the point where we have vessels as well as nerves entering into the spleen. So at this point here. This is showing for us the venous drainage of the spleen. You can see the veins or the splenic vein also being as large as the splenic artery, emerging from the hilum of the spleen and descending towards the superior mesenteric vein. And the splenic vein unites with the superior mesenteric vein to form the portal vein. Eventually, the portal vein will drain all the way up towards the liver. The spleen tends to be drained of lymph by lymphatic vessels that would end at the pancreatico-splenic lymph nodes. These are lymph nodes that are found very close to the splenic hilum, and they are also found along where the pancreas is, hence the name. And eventually, from these pancreatico-splenic lymph nodes, we have lymph now eventually draining into the celiac nodes. So let's dive into the histology of the spleen. The spleen is an organ, first of all, surrounded by a capsule. The capsule is made up of dense connective tissue, and the capsule tends to have extensions. that tends to be called trabeculae. These extensions penetrate into the spleen and divide the spleen into different subparts. The parts in which the spleen are divided to is called the splenic pulp. And as the trabeculae of the capsule are entering or into the spleen, they tend to carry with them splenic artery, branches of the splenic artery, splenic vein, lymph nodes, and of nerves. And each of the splenic pulp will be divided into two major compartments. Splenic pulps could either be a white pulp or a red pulp. We'll talk about each of them there. But just to uh, reiterate what I said at the start of the lecture when talking about the functions of the spleen, aside being involved in immune functions, also serve as a form of blood reservoir and could also be involved in cell transfusion. And this is evident in the presence of the two forms of the splenic pulp. The white pulp is involved in the immune function of the spleen. The red pulp is involved in the blood storage and um, other blood functions or red cell functions of the spleen. This is the picture of the spleen in in-depth view. You could see the outer capsule of the spleen here in pink, and you notice how that an outer capsule forms trabeculae. Trabeculae is this set of structures, connective tissue structures that will invaginate the spleen, penetrating through it and dividing it into splenic pulp. And you can see the splenic pulps present here. You can see this is one splenic pulp. It has a red portion and a white portion. The red portion is called the red pulp, and that's the area we can see in the pink and this area. And then the white portion is shown directly here. This is the white portion present here, and that is the area involved in the immune function of the spleen. Just once again showing us the divisions of the spleen. You notice the capsule forming trabeculae. Trabeculae is the penetrative part of the capsule, and this trabeculae divides the spleen into a splenic pulp. Splenic pulps tend to contain a red segment, or what we call a red pulp, that which is the outer part, and then the white segment, which is the inner part, which is called the white pulp, as you can see. So we'll talk about each of these aspects of the spleen one by one as we go along uh, the model. The white pulp of the spleen tends to form about 20% of the spleen. It consists of three major structures. The three major histological structures of the white pulp includes lymphoid nodules, the periarteriolar lymphoid sheaths, or what we call piles, and then the splenic microvasculatures. And quickly, what to remember about each of them in terms of the lymphoid nodules tend to contain a number of B cells which will be involved in immune functions, particularly antigen presenting functions of the spleen. And then the periarteriolar lymphoid sheath, or what they call piles, contains largely T cells and macrophages, and this is also involved in the immune function of the spleen. The last aspect of the white bulb includes splenic microvasculature. This comprises of a network of uh, arteries and veins, arterioles alongside venules that tend to run within the white bulb. If we are to talk about them, first of all, we have to trace back the blood supply of the spleen and then go from a more macrovascular, macrovascular components and then trace it down to the microvascular components that we then to see in the white bulb. So in the blood supply, we start from the splenic artery. The splenic artery enters into the spleen at the hilum and then further divides into segmental arteries. Segmental arteries would now further divide to form trabecular arteries. These are the arteries that tend to be found within the trabeculae. Remember, the trabeculae is the extension of the connective tissue or dense connective tissue capsule around the spleen that tends to divide into splenic pulp. So within that trabeculae, we have trabecular arteries, which are minor branches of the segmental artery. Then trabecular arteries will now give off smaller vasculature, what we call microvasculature. And this microvasculature coming from the trabecular artery would be what would form the splenic microvasculature within the white bone. So we have the central arterioles being the first, and then central arterioles will now further divide or branch to form what we call peninsular arterioles. Now, it's important to note that the peninsular arterioles are in close proximity with another component in the white pulp, and that component is the periarteriolar lymphoid sheath, what we call PALS. So this is an image showing us the microvasculature alongside the other structures found within the white pulp. We will notice the um, trabecular arteries found here, first of all, divided into central arterioles, Central arterioles will now go on further to divide into pencillary arterioles, as you can see. The pencillary arterioles that are present here are in close proximity with the second component of the white pulp, which is the periarterial lymphoid sheath. The name itself gives it away. It's called periarterial lymphoid sheath because it's surrounding the pencillary arterioles and also surrounding the central arterioles. As you can see, this is the periarterial lymphoid sheath. It contains largely T cells alongside macrophages, and that's very important to note. Aside those two components, we also have the lymphoid nodules. The lymphoid nodules contains largely the B cells, as shown here. Let's talk quickly about the red pulp. The red pulp is the second part of the splenic pulp within the spleen. It makes up about 80% of the spleen. It consists of two major parts, the splenic cord and splenic sinusoids. The splenic cord contains a number of immune cells. So the red pulp, though it's involved in largely red blood cell function, it is also involved in a little bit of immune function. So because it contains T cells, B cells, and macrophages, and then a mixture of red blood cells and reticular cells within its splenic cords. The splenic sinusoids, on the other hand, are capillary networks or within the spleen. This originates from the pencillary artery. So, as we have the pencillary artery ending in the white spot, these pencillary arteries will eventually terminate by becoming fenestrated endothelial linings. These fenestrated endothelial cells gives rise to the splenic sinusoid. The cells that tend to form the fenestrated endothelial linings tend to be called staph cells, and the particular function of the sinusoid is to drain fluid from the pencillary arterioles and then eventually drain it back to venules. And these venules will become part of the venous system that will drain back into the white pulp, forming veins in the white pulp and eventually coming out as the splenic vein. So it's just a very beautiful way in which the spleen is made up. We have the splenic artery entering at the hilum being broken down into segmental arteries, and then segmental arteries becomes trabecular arteries within the trabeculae. Trabecular arteries would eventually give rise to the splenic microvasculature, starting with the central arterioles. Central arterioles enters into the white pulp first, surrounded by periarteriolar lymphoid sheaths, and then they become pencillar arterioles. Pencillar arterioles usually are the last set of microvasculature in the white pulp. The pencillar arterioles, also being surrounded by pals, would eventually end by penetrating into the red pulp to become splenic sinusoids. Splenic sinusoids contain staph cells, which are and they are fenestrated, and then the splenic sinusoids drain fluid or drain blood into the small venules, and small venules within the red pulp would eventually become veins in the white pulp, and these veins will follow the same pattern. We have central veins becoming central venules, becoming trabecular venules, becoming segmental veins, and eventually becoming splenic vein, which drains venous blood out of the spleen and into the portal vein. And this is an image of the red pulp in in-depth view. You can see the arterioles, the pencillar arterioles becoming the splenic sinusoids here. You can see they are fenestrated structures. And this fenestration here has helped red blood cell storage, because remember that the spleen serves as reservoir for blood. And the reason why is because the red pulp itself is the site of reservation for blood. The reason is because of the presence of these fenestrations in the splenic sinusoids. They allow for exit of red blood cells, allow for exit of immune cells out of the sinusoids and into the substance of the red pulp. And that's where blood tends to be stored. And if there's a need for transfusion to occur, blood will move from that red pulp into the sinusoids and eventually be drained back into the veins. And from there, this blood will be sent to the rest of the body as a form of self-transfusion. The spleen begins to develop by the fifth week. It's derived from a mass of mesenchymal cells that is located between the layers of the dorsal mesocastrum. This is very important to remember in terms of the embryology of the spleen. So dorsal mesocastrum tends to be the site between the layers of the dorsal mesocastrum, and the particular origin point for the spleen are mesenchymal cells. Initially, the spleen tends to be lobulated in fetal life, but the lobus eventually disappears before birth. And during development, when the foregut is rotating, the rotation of the foregut will translocate the spleen to the left side of the abdominal cavity. And that's why we have the spleen being found at the left hypochondrium. Hematopoiesis as one of the functions of the spleen tend to begin around the third month of of each intrauterine life. This is an image showing us the development of the spleen. You can see how the spleen begins to develop from the layers of the dorsal mesogastrum, and this is the dorsal mesogastrum shown here, two layers, layer one, layer two. And what you notice is that we have parenchymal tissues aggregating there, and as they aggregate, they eventually will give rise to the spleen at this point. So this is the spleen forming. The spleen will now rotate further when you have rotation of the foregut occurring, and that rotation leads to it being translocated to the left side of the abdomen, as you can see in the image. And once again, the development of the spleen is shown fully well in this image. You could see the mesogastrum, you can see the ventral mesogastrum here, and we can see the dorsal mesogastrum also here. But particularly what should pay attention to is the development of the spleen within the layers of the dorsal mesogastrum, as you can see. So within the layers of the dorsal mesogastrum, you have the mesenchymal tissues coming together, forming the spleen. And then after the rotation of the foregut occurs, that spleen is translocated from the central to the left side of the abdomen. Let's talk quickly about some clinical applications to spleen. This will include the splenic rupture. Splenic rupture could occur in usually traumatic conditions where we have a penetrative injury to the left hypochondrium of the abdomen or to the back. And although the spleen is surrounded by ribs posteriorly, it is still one of the most vulnerable structures in the body, and it could undergo rupture whenever there's a punctural wound to the abdomen. Another form of splenic abnormality is splenectomy, um, which could either be a pathological splenectomy or the surgical splenectomy. Pathological splenectomies tend to occur when the spleen by itself it gets destroyed without surgical intervention, and this is typically seen in children with sickle cell disease. Then we could have a form of surgical splenectomy in which maybe an individual is undergoing hepatosplenomegaly, or in the case where there's a splenic rupture and the spleen is losing a lot of blood leading to hypovolemia, we need to remove the spleen from the abdomen to prevent hypovolemic shock from occurring, or to prevent um, whatever complications of the splenectomy or splenomegaly we are experiencing. So splenomegaly is also a clinical significance. This is when the spleen is markedly enlarged. This is typically seen in children with sickle cell disease. It's also seen in individuals with some form of blood cancer like leukemia and lymphoma. Remember, the spleen is the largest lymphoid tissue. So if you have a lymphoma or leukemia, one of the common complications of that would be an enlarged spleen. And then finally, we have an accessory spleen being a clinical significance, which is just an aberration in which there's an extra spleen aside the one found in the left hypochondrium. This is an example, a picture of a ruptured spleen. This is probably due to a trauma or due to maybe a crush injury or penetrative injury that led to the destruction of the spleen. And that concludes our model of the spleen.